This is my OB research project on Sirenomelia. The learning outcomes for this project are to be able to explain what Sirenomelia is and describe it, understand what type of patients are commonly diagnosed with this condition, know risk factors that are associated, name symptoms that are associated, be able to describe the sonographic appearance of Sirenomelia, specify treatments that are currently available to patients, and what other modalities are helpful in confirming this condition, and also describe the progression and prognosis for Sirenomelia. Definition. Sirenomelia is a very rare congenital deformity in which the legs are fused together, giving them the appearance of a mermaid's tail. It is characterized by rotation and fusion of the legs, and is also known as mermaid syndrome. There are three main subdivisions of Sirenomelia, and that's based on where the bones are fused together. The first is Sirenomelia dipus, the second is Sirenomelia unipus, and the third is Sirenomelia apus. Characteristics. Affected infants are born with partial or complete fusion of the legs. The tailbone is usually absent and the sacrum is partially or completely absent. In some individuals, Sirenomelia is theorized to result from irregularities in early development of the blood circulating system, a disruptive vascular defect of the development of the vascular system within the embryo. Vectoral association is a non-random association of birth defects that affects multiple organ systems. The term vectoral is an acronym with each letter representing the first letter of one of the more common bindings seen in affected children. V. Vertebral abnormalities. A. Anal atresia. C. Cardiac defects. T. Tracheal anomalies, including tracheoesophageal fistula. E. Esophageal atresia. R. Renal and radial abnormalities. L. Limb abnormalities. In addition to the above-mentioned features, affected children may also exhibit less frequent abnormalities, including growth deficiencies and failure to gain weight and grow at the expected rate. Diagnostic process. A diagnosis of Sirenomelia can be made prenatally, most often during the second trimester, by fetal ultrasound. The lower extremities typically appear fused into a single limb, and there can be sacral agenesis to varying degrees. Ancillary sonographic features include presence of a single umbilical artery, presence of oligohydramnios. Case study. A 27-year-old Gravida 3 Para 1 was referred for evaluation of a 22-week gestation. Her past medical history included one miscarriage early in the pregnancy and one premature birth who was alive but blind. The patient also had a history for diabetes for the past several years, which had been poorly controlled. A sonogram performed elsewhere revealed severe oligohydramnios, bilateral small fetal kidneys, absence of fetal legs, and lack of fetal movement. Her exam also demonstrated no fetal movement for over 25 minutes, and IUGR with parameters corresponding to 17 to 18 weeks. The anatomic study of the fetus demonstrated a fusion of the lower extremities with 2 femurs, 2 tibias, and a single fibula with 2 feet. The legs were completely extended in a pike position over the head. At the level of the kidneys, bilaterally enlarged hypoechoic structures were identified. They were thought to represent enlarged adrenal glands in view of the common association with bilateral renal agenesis, but represented polycystic kidneys. Because of the usual incompatibility with postnatal life, termination of pregnancy was decided upon by the parents. Unusual presence of external genitalia was also recognized. Case study. Shiloh Pepin was born with Sirenomelia. Sirenomelia is almost always fatal in newborns, but Shiloh defied doctors' expectations. She lived to the age of 10 years old. According to Dr. Matthew Hand, she was missing a whole series of organs, including her uterus and her bladder and her large intestine. She had no vaginal vault or rectum and no way for urine to get out of her body. Most of these babies died because of poor renal tissue makeup in their body. Having her first kidney transplant at age 2 and more than 150 surgeries and years of kidney dialysis in the 8 years that followed, she spent her life under the care of doctors. Shiloh was one of only 3 people in the world known to have survived this condition for any length of time. She died of pneumonia. Related pathologies. Additional conditions may occur with Sirenomelia, including imperforate anus, spina bifida, cardiac malformations. Other associated anomalies include Potter's facies, single umbilical artery, bilateral renal agenesis, absent or ambiguous external genitalia, vertebral defects, abdominal wall defects, chest deformities, and anhydramnios. Statistics. The exact cause of Sirenomelia is unknown. Researchers believe that both environmental and genetic factors may play a role in the development of the disorder. Most cases appear to occur randomly for no apparent reason, which suggests environmental factors or a new mutation. Most likely, Sirenomelia is multifactorial, which means that several different factors may play a causative role. In addition, different genetic factors may contribute to the disorder in different people. Sirenomelia affects males more often than females by a ratio of 2.7 to 1. The exact incidence is unknown, but Sirenomelia is estimated to occur in approximately 1 in 60,000 to 100,000 births. Sirenomelia occurs with greater frequency in one twin of identical monozygotic twins than it does in fraternal dizygotic twins or individuals. Treatment. Treatment may require the coordinated efforts of a team of specialists. Pediatricians, surgeons, cardiologists, orthopedists, orthopedic surgeons, kidney specialists, and other healthcare professionals may need to systematically and comprehensively plan an affected child's treatment. Surgery has been successful in separating joined legs. In preparation for surgery, balloon-like tissue expanders are inserted under the skin. When they are filled with a salt solution over a period of time, the balloons expand, making the skin stretch and grow. The excess skin is then used to cover the legs once they are separated. Sirenomelia is usually fatal in the newborn period despite treatment. Prognosis. The condition is often fatal and incompatible with life. Exceptional cases with renal agenesis may survive. Depending on the country you live in, a termination of pregnancy could be considered in some situations. The following references were used to help contribute to this OB research project on Sirenomelia. Thank you for listening.